is this for? Is this just for old people that have bad wrinkles and saggy tissues?
No, actually, it can be, but there's a lot of patients that are candidates even long before they start to really feel like their skin's in bad condition. So patients who have unwanted lines of expressions are going to be ideal Botox candidates. We like to call it preventative maintenance, and starting very, very conservative early on is going to help with, keeping a natural appearance. Usually it lasts, about average 3 months. Filler, it all depends on the patient, depends on the area that we're doing and the look that they're going for, the kind of look they're trying to achieve. So it's really patient specific, at least that's how we always really want to start. But I always say let's start conservative, and then let's have you come back in 2 weeks if needed. It is a medication, so it takes time to work. It's not this instant gratification like, a lot of fillers can be. Fillers are great from kind of the cheeks down.
It's pretty instant, though. It's really within a week.
Within a week, you definitely see that result, and people love it because it's just like, they can plan ahead and look great for a reunion or a wedding or, just anything coming up, and it's relatively quick, so. So the ones here, kind of in between the brow, we call that glabella area. Those are called your corrugators and your procerus muscles most commonly. Then you have your frontalis. It's going to lift the forehead. Those are very important. Those elevate the eyebrows. So we always want to treat that muscle really, really well so we don't overdo it. And then we have this auricularis oculi muscle that does create the deep lines when we do the little squinty smile.
Yep.
So cute. So that's the most common area, and then again, like you said, we do off-label, use it in other areas. Some of my patients love it when we do these depressor muscles down here with just a tiny little amount. It just softens that little jaw line and the marionettes. So it's really, really nice.
And even 1 or 2 units on the lips can be helpful for some lip lines.
It can soften those too.
And we do have suggestions, basically requirements for preparing for a procedure like this. What are those?
So you want, if possible, if you've got some time, try to cut back on any NSAIDs. So your ibuprofen, your naproxen, your alcohol. That's another one that's, try to go easy on that. So anything that's going to thin the blood, it can make you bleed a little bit more. We know this, when we prep patients for surgery, very important. So it's same with any sort of needle going into the skin. You run that risk of having some bleeding. So anything we can do ahead of time to minimize it.
That pineapple is a secret food, right? It heals the body.
It can. It's
bruising.
beneficial. I like to tell my patients to use that or to eat fresh pineapple after they do any kind of injections because it's the bromelain in the fresh fruit can be really helpful to help the inflammation and help the healing process. So. 1, 2, 3, poke.
Are you doing it?
I sure am.
All right. Thank you very much. Enjoy your journey. Good night.